Good afternoon, Dr. Fortes from the USA.
Bruchem Habayim. Thank you very much for attending today. And good afternoon. My name is Paul Fortes. I live in the United States. I'm a plastic surgeon in Houston. And I practice with a group of other plastic surgeons that do cosmetic surgery primarily. I wanted to thank the Israel Society for Plastic Surgery for giving me the opportunity and for the privilege of being here and discussing this information with you. I first would like to say that I have no financial interest with any of the manufacturers of postoperative garments, and that none of the authors received any financial funding or reimbursement. The Morena Group did donate 50 garments to our study, and we as a group supplied some study garments as well. I wanted to pose this question to you. Is there scientific evidence that patients are obtaining better results using compression garments? And if so, why and with which type of garment? The idea of compression as a means of treating patients for medical illnesses is not a new one. It may be new in the field of plastic surgery because plastic surgery is a young field. But the idea of compression is a very ancient one that goes back even before 600 BCE. Within the field of plastic surgery, however, there was a bit of a revolution that occurred in the late 70s that was brought about by Dr. Illouz in France, who developed the concept of performing suction-assisted lipectomy, whereas prior to his advancement of the field, lipectomies required large and more extensive direct excisions. As part of his investigation in this area, he also introduced the concept of using compression garments for patients having undergone suction-assisted lipectomy. Because he was ahead of his time, he had to develop these ideas really from scratch. He, along with his French cohorts, designed studies to compare the length of time that was appropriate for patients undergoing liposuction to have compression garments applied to their body. He also determined the exact pressure range that was necessary in order to achieve the best results for his patients. He found, number one, that pressures of garments under 18 millimeters of mercury were ineffective and gave very poor results. And number two, that pressures above 22 millimeters of mercury were often associated with significant complications related to thrombosis of the veins. So it was in that range between 18 and 22 millimeters of mercury that he found was an appropriate and therapeutic range for wearing a liposuction garment. He also followed his patients and found that characteristically, immediately after liposuction, the volume of the tissues went down, and over the course of 2 weeks, it gradually went back up. And we owe this to the edema that occurs in the tissues. Following that 2-week period of tissue swelling, he found that progressively the swelling went down over the course of the next 4 to 5 weeks. And so throughout the period of recovery, the initial 2 weeks was a period of swelling, and the last 4 weeks was a period of swelling resolution. And it was this period of time that he felt it was necessary for his patients to wear these compression garments. After his seminal investigations and his published studies, there's really been very little information that's new in the field of compression garments. Sure, there's a lot that has been learned in the course of the last 20 years about how to perform liposuction, how to perform it safely. I want to point out to another author that made a big leap in the development of liposuction, and that is Dr. Klein, who introduced the concepts of wetting the tissues, the idea of using solutions containing saline, to which was added epinephrine and even lidocaine, to allow for a higher volume of liposuction to be removed safely without the amount of bleeding that was previously associated with the operation. and also for the operation to, in many cases, to be done with local anesthesia alone. I want to point out also a couple of other studies that describe the use of liposuction for treating lymphedema following breast cancer surgery, lymphedema of the upper extremity. But beyond these studies that you see here, there has been very little on the subject. I want to mention one particular study in the Italian literature, Campiglio from 1999, who described 20 of his patients that underwent suction lipectomy and use of compression garments with a raised weaving. This was probably one of the few pieces of literature that was done to describe liposuction garments after the operation. And although he may receive credit for doing that, this paper really was more anecdotal than scientific, because he did not have a group of patients that served as controls to his 20 that underwent liposuction. And the most that we can conclude from his paper was that patients that he performed surgery on were satisfied overall. I want to quote one of my partners who said very succinctly that compression garment comfort is important because comfort is directly related to the wearability, or in the case of medical garments, of compliance for using the garments. Now, the concept of comfort may not seem like a scientific one at all, because it's very subjective. People have their own ideas of what's comfort and what's not. However, there have been researchers that have studied it and come up with conclusions of really how to go about defining the concept of comfort. I point these three authors that are listed in the literature that describe a combination of physiological, and psychological input on the part of the patient to his exposure to the environment as a direct cause of his or her comfort. But more applicable studies in the literature have reflected how comfort impacts the satisfaction with apparel. These four at the very top were studies that showed that the number one factor in determining person satisfaction with wearing apparel was comfort. The second two was directly related to the use and the wearability of compression socks. And again, these two investigators groups found out that satisfaction was determined primarily by comfort. And Branson and Sweeney put it all together and came up with a concept that comfort is really related to multiple factors: physiology, psychology, and exposure of the skin and the senses to the environment, including the environment of the garment.